A recent SANDAG study found methamphetamine use was up by 8% in women and 5% in men who were arrested in San Diego last year compared to the year before. Local hospitals and the medical examiner's office also document a rise in meth use. Here with more on why the drug seems to be making a comeback and what to do about it is Cindy Burke, Director of Criminal Justice Research at SANDAG, and Alfredo Aguirre, Director of San Diego County Behavioral Health. Welcome back.
Thank you.
Cindy, how'd you get these statistics?
We go into our local jails and juvenile hall. We talk to people who've been arrested, and then we also get a urine sample. A lot of the data that's out there about drug use trends over time, it's the general population and just that self-report information. We're able to really have a good, lengthy conversation with people and supplement that with the urinalysis and find out more what's going on with an at-risk population, people who are coming into contact with the justice system.
How much can these statistics tell you about what's going on as far as methamphetamine use in San Diego County?
Well, we want to track it over time, which is one thing, again, among that at-risk population, but the Meth Strike Force uses it with other measures. And for this report, when we put it out, we wanted to see, is this consistent with other trends we saw? So we know that meth seizures are up through the DEA stats. We also know that through the medical examiner's data that deaths are up related to meth. So we do think that those trends are all consistent, pointing in the same direction. And we also know that many times individuals who come into contact with the system, we see that those trends there are then later mirrored in the general population.
Okay, and Alfredo, in the 1990s, San Diego was considered the meth capital of the country. Then things sort of subsided a little bit, and now it seems like it's back on the rise. Why do you think that is?
Well, clearly the demand is high. The cost is apparently lower. And what we're seeing is, I think, for both women and men, but particularly for women, what we're seeing is certainly the issue of maybe being concerned about weight gain, using meth for that. Other issues have to do with maybe trying to do as much as possible to achieve good grades in college, or just the issue of we know that in terms of mental health conditions, women more than men tend to internalize more depression, and certainly methamphetamine use gives one a euphoric result. And so that counters that. And it sometimes starts out towards achieving some goals, and then it has a slippery slope and it becomes quite addictive and a big problem.
Well, and Cindy, your report found that the drug is used more by women than men, and as Alfredo said, that's rather historic. What did it say about teen use? Is that on the rise as well?
Well, that's one of the good news pieces that we saw. Back in 2005, we saw 21% actually tested positive of the juveniles who were booked into juvenile hall. The past 2 years, it's been 4%, so a lot lower than
from 21 to 4.
Yeah, so it's been a lot lower. For the adult females, it was 47%. About 1 in 2 of the females booked into Las Colinas or one of the other adult facilities are testing positive, and about 31% of the males. So just for the comparison there.
Alfredo, you coordinate the county's 6 drug treatment programs. How does someone get admitted into a program, and what sort of services are offered there?
Probably the easiest way to get into, if you're not certainly directed by the justice system, we have an 888 number that is an access and crisis line, and they know the resources. Actually, we go beyond those 6 programs. We actually have 50 specific programs across the county, and so that's the easiest way. And some of them are basically community-based outpatients. Some are residential, really depending on the condition and the state of the condition, where the person is in the course of it.
In general, I know each of the programs vary quite a bit. How successful are the treatment programs, especially when it comes to meth use?
I believe it's quite successful when you have leverage. What we found with drug court programs, been to a graduation very recently, is it's incredible to see once they obviously see there's someone leaning on them, and they realize this is their last chance, and their other option is extended jail time. That really sends a message, and that's not the only message, but certainly with drug courts, they work with the whole family, and the family gets engaged. And what's amazing about these graduations, when you see a successful person who's really in their achieving well in their recovery, is to see just the looks in the family's eyes when they see their loved one receiving their award of having completed a drug court program. So that's an example. I mean,
it's certainly one way to tackle the problem, and I just want to give Cindy a chance to answer this of what else needs to be done to turn this around.
You know, it's a comprehensive strategy. We have efforts already in place through the Meth Strike Force. The sheriff is working with HHSA, Health and Human Services. It takes prevention. We need to get the message out there that even if you try it once, you don't know what the effect's going to be. So we need to get the message out there that this is a dangerous drug. We don't have the labs in San Diego County, but it's coming across the border. It's on our street. It's cheap. It's easy. It's dangerous. Number two, treatment is available, and law enforcement needs to be out there. We all need to work together.
As a whole team effort. All right, Cindy Burke and Alfredo Aguirre, thank you.
Thank you for covering this.